My name is Osman Jaffer, Registrar of Vascular Surgery.
I'm Mohammed Aslam. I manage the vascular laboratory at Hammersmith campus.
And in this short video we'll demonstrate the assessment, the duplex assessment of an arterial stenosis.
The first thing to do is to select the appropriate probe. Press the exam button on the far left of the keypad, use the trackball to select Patient position is very important. Do not have the patient too high, as this is very ergonomically uncomfortable. Select an appropriate height and scan at that level. Hold the transducer in this manner. The notch being indicated corresponds to the M symbol on the display. The use of acoustic gel is very important to facilitate passage of sound waves into the patient. The first image you will get is the B or brightness mode image. Adjust the overall gain on the far right of the keypad to achieve an appropriate gain. You will need to select an appropriate depth of field. Use these depth arrows to increase or decrease the depth. There will be markers on the right of the screen. The time gain compensation sliders on the top right of the keypad change the amplitude of the signal at various depths of the ultrasound field. This is to compensate for sound attenuating the deeper it goes into the patient. Use this oblique arrangement to amplify the deepest and therefore most attenuated part of the field. Turn on the color Doppler ultrasound by using the button labeled color to the right of the trackball. You will see the color box being brought up. The size of the box can be changed by pressing the set key and moving the trackball upwards and downwards and to left and right. You may change the steering of the color box by using the multifunction knob to the right of the trackball. Pulse wave spectral Doppler sampling can be done by pressing the PW button to the right of the trackball. This brings up the sample volume. The sample volume can be placed where you want it to sample from. In order to get the tracing, you need to press PW again. You can ask the machine to tell you what the various indices are by selecting Auto Calculate. Auto Calculate is selected from the soft keys at the top of the control panel. Scroll down and switch Auto Calc on. This will give you a display. The peak systolic velocity should be taken at the stenosis where the velocity will be highest, and also either in the pre or post stenotic region to be able to calculate the peak systolic velocity ratio and hence give you an indication of the degree of stenosis. The term aliasing refers to ambiguity in the assessment of the spectral waveform by the machine. This happens because the machine is sampling at too low a frequency. This can be corrected for on the scanner, which will automatically increase the frequency of sampling, or by moving the baseline down as demonstrated. secondary way of assessing the stenosis is a direct luminal measurement. The stenosis can be assessed in longitudinal section as shown, the picture frozen, and then a caliper measurement done of the stenotic region as compared to the normal pre- or post-stenotic region. The calipers can be brought up using the measure key on the left and above the trackball. Reporting of the degree of stenosis is done using this chart. You can see a decile scale is available for the degree of stenosis. Secondarily, direct luminal measurement should also be recorded appropriately.